All right, welcome. This is the Family Planning Elevated Contraceptive Access Program webinar. I'm Caitlin Quaid, the Program Manager of FPE CAP for short, and I'm joined today by my Family Planning Elevated colleagues. So we have here Kyle Myers, Program Director, Rebecca Simmons, our Evaluations Director, Alex Jarrow, Research Analyst, Maddie Mulholland, Project Facilitator, Jessica Lewis-Caporal, Nurse Practitioner, and we are grateful for the support of our additional colleagues, Dave Turok, Medical Director, Jess Sanders, Research and Policy Advisor, and Jamie Bate, Research Analyst. So today's webinar will provide an overview of FPE CAP, and we have a pretty simple, straightforward agenda. To start off, I'll be talking about the background of the program and delving into the program details themselves, what clinics sign up for when they become FPE CAP members. We'll talk about applying for FPE CAP and review each of the 3 application components: the online application, the monthly data report, and the budget. And a friendly reminder that applications are due July 1st. And then lastly, we'll have time for questions. So please note that attendees are currently muted. If questions come up as I'm going through these slides, you can use the chat function to submit a question. And then also feel free to be bold and unmute yourself when we get around to question time. Today's session is recorded, and we'll make the slides and recording available on our website afterwards. We'll also post any questions posed and answers to our frequently asked questions page. So what is FPE all about? We are committed to expanding access to comprehensive contraceptive services for Utahns, and to accomplish that, we're focusing on 3 things. First, FPE connects patients with resources so that they can get whatever contraceptive method they want without any economic financial barriers. Secondly, we're working with providers, and we're training providers and staff so that they can offer the full range of contraceptive methods to clients. And then third, we're assisting policymakers in passing evidence-based legislation that works towards expanding equitable and affordable access to contraceptive services. And it's no coincidence that Family Planning Elevated is happening right now in 2019. FPE happens to be the younger sister of a different contraceptive access initiative our team undertook in recent years, called Her Salt Lake. And Her Salt Lake provided no-cost contraception to nearly 7,500 individuals by partnering with a family planning clinic here in Salt Lake City, removing access barriers and cost barriers to methods, training up providers, and using data from the study to influence policy, including the Medicaid family planning waiver, which was later incorporated into Medicaid expansion. So as sibling rivalry dictates, Family Planning Elevated has grown up wanting to be bigger and better. FPE also couldn't exist without the generous support from our sponsors, including private foundations like the Arnold Ventures, the Dr. Ezekiel R. and Edna Wattis Dumke Foundation, the Sorensen Impact Center, and pharmaceutical manufacturers who donated our devices. I just mentioned the policy environment, and in Utah, policy on public funding for contraceptives creates something that we call the Contraceptive Coverage Gap. And this is the gap that roughly 100,000 women in Utah find themselves because of their income level, immigration status, where they work, or where they live. So on one side, we have many people who are lucky to work for a company that offers health insurance. They can afford premiums with the Affordable Care Act subsidies. And due to the ACA contraceptive mandate, many of these folks are now able to access methods like IUDs and implants that typically have a high cost without a copay. And then over here on the other side, due to the recent Medicaid expansion in Utah up to 100% federal poverty level, a lot more Utahns than ever before can access contraceptive methods without cost sharing. But for those individuals at 101% federal poverty level, making around $1,200 a month, they don't qualify for Medicaid, and their employers may not offer insurance that they can afford. And then we also have here in the coverage gap Utahns who are undocumented and aren't eligible for Medicaid. The truth is that uninsured folks in the coverage gap are most likely to experience an unwanted pregnancy because they didn't have that access to preventative health care. And what Family Planning Elevated aims to do is provide contraceptive coverage for these Utahns. So everything here in purple. And that's where FPE CAP clinics come in. So we provide each of these following supports so that you can ensure services for your clients. FPE CAP clinics receive a cash grant up to $100,000 per organization for the 2-year project to buy supplies and equipment, hire personnel, basically whatever is needed to get clinics to that next stage of being able to support contraceptive service delivery. The installments of the cash grant are dispersed every 6 months as program milestones are being met. And we'll have an opportunity to talk a little bit more about the cash grant when we take a closer look at the budget. We also provide customized training, education and training for health center staff. So IUD, implant, and even vasectomy training for providers. Patient education for clinic support staff like MAs and RNs, forecasting, billing, and stocking training for clinic managers or front desk staff. Some of these educational offerings are available on site, some are offered remotely through webinar, and the like. We also cover the cost of contraceptive methods for clients who are FPE CAP eligible, who fall into that coverage gap. And we do that by providing IUDs and implants to clinics directly, by driving them out to your clinic and making them available to you, and by reimbursing clinics for short-acting methods. And not only do we cover the cost of the methods themselves, but we also reimburse clinics for contraceptive services and procedures provided to FPE CAP eligible clients. So covering the time involved in doing that counseling and providing care. So some reimbursable services could include counseling on contraceptives for new and established patients, as well as starting and stopping some of those provider-dependent methods like IUDs and implants, vasectomy, injection of depot. And I'll note that a list of covered services is available in the RFA. And I do want to make a note that it does not include, for example, well women visits with pap tests or STI tests outside of the context of an IUD insertion. And the FPE CAP reimbursement rates are equivalent to current Medicaid reimbursement rates. This fall, we'll be launching a statewide and localized marketing campaign to raise awareness and demand for covered contraceptive services, both those available through recent Medicaid expansion, but also those available at FPE CAP clinics. And then lastly, we'll be using the data we collect from FPE CAP's health centers to do 2 things. One, we're going to analyze and return that data back to clinics for your own use in grant proposals or for clinic decision making. And secondly, the data will also let us evaluate the impact of Family Planning Elevated, and we'll make evidence-based policy recommendations at the local and state level. So what do FPE CAP members commit to in return? We have, number 1, receiving technical assistance. So participating in that, the all-staff technical training, which is customized to what your clinic actually needs to deliver comprehensive services. And again, that TA could take the form of on-site training and proctoring, perhaps a regional training, or remote TA webinars, or even sharing experiences with other FPE CAP sites. And clinics commit to completing with us quarterly update calls budget updates so we can see how you're spending your cash grant, and an annual clinic observation visit for additional TA and support. In order to get you paid each month, we'll need to collect information on the number and type of services and contraceptives provided. And we do that using an encounter form for reimbursement. As a reminder, clinics are reimbursed for methods, those that we haven't stocked directly to the clinic, as well as services. And both of these things, these ongoing reimbursements, are completely separate from the cash grant that clinics receive. And then third, submitting monthly data. I mentioned that we'll be collecting data on the healthcare services provided at your clinic each month, and this is compiled as a report from your EHR. And this is the same report that we're asking for as part of your application. If this sounds like a tall order, I want you to feel assured that support is available here on our team for your staff in setting this up, and we'll get to that in just a minute. So it's not just a dream. FPE CAP is really happening, and how has it been going? Well, in February, we launched our first cohort, and we now have partners in Ogden, in Midvale, and in Price, and they are on track to provide no-cost contraceptive care to 3,300 clients by the end of next year in just these 3 locations. So we're really excited to welcome cohorts 2 and 3 into the project and really build off the great work that's already happening in cohort 1. And then the timeline in the grand scheme for this project, as I mentioned, we launched cohort 1 earlier this year after our first RFA went out last fall, and we've collected historical data from cohort 1. We'll continue to collect monthly service delivery data for the 2 years of the project, and then for 1 year after the project. And here we are in mid-2019, launching our second RFA to select cohort 2. Similarly, we'll be collecting historical data from January 2018, 2 years of project implementation, and a year after data collection. And then we anticipate being able to select cohort 3 from this current round of applicants. And so for those in need of a little bit more prep time, you'll note in the application you can select your preference, cohort 2 or cohort 3, with cohort 2 beginning in October and cohort 3 beginning in January of 2020. So let's talk about who's eligible. We are limiting selection of FPE CAP clinics to existing health centers in Utah who serve a significant portion of uninsured or underinsured patients, at least greater than a quarter of patients uninsured. And underinsured really just refers to those whose commercial insurance doesn't cover contraceptives and who end up having to self-pay for their contraceptive methods. So despite the mandated coverage through the ACA, we know some plans were grandfathered in, or some employers opt out of covering contraceptives for religious reasons, and we are aiming to serve those individuals as well. And really that's speaking to that contraceptive coverage gap that we talked about earlier. Similarly, with serving clients who are at less than 250% federal poverty level, we want to make sure that there are clients who are actually eligible for FPE CAP that are walking through your doors. Serving Medicaid patients. Now, why, you might ask, is this a requirement? And while FPE pays for methods and services for those in the coverage gap, as we talked about earlier, another aim of the project is to improve the contraceptive offering for all clients, especially those who are newly eligible through Medicaid expansion. And so in order to achieve this carryover effect now and in the future, we're selecting sites that have Medicaid enrolled clients and are able to successfully bill for their Medicaid clients. And then lastly, having access to discounted contraceptives through the 340B program. Most of you will probably, most FQHCs will have 340B pricing, FQHC lookalike sites, as well as health centers receiving federal funding as an STI testing site. And really this designation just allows us to stretch our program funds a little bit further. It makes a big difference when we're reimbursing $1 or $2 for depot versus a couple $100. So that is a program requirement. For selection criteria, I'd refer you to the RFA for more details on each of these elements, but I just want to highlight overall what we're looking for. Commitment to community need and impact. So considering how great is the need in your community for covered contraceptives, and also how many people would this impact in your community. Organizational commitment, that's both to providing quality comprehensive services and also to getting us what we need to keep the program running. So a lot of those programmatic and data requirements that we talked about. Organizational capacity, so do you have the right people, the right equipment, the right structure, and relationships in the community to make this project a success? And lastly, plans and approach. So if your capacity is not quite there yet, we want to know how you're going to use this cash grant to get there, whether it's reorganizing your clinic flow, leveraging community partners, whatever it might be that you have in mind. So that's what we're looking for, and the application process is going to help us see if you're a great fit for this program. So let's look at how to apply. Most of you have probably seen this website, but if some of you have managed to avoid it, you can check it out here. And this landing page has all the links that you'll need for downloading templates and accessing the online application itself. Reminder that applications are due on July 1st, just a little under a month from today. And there are 3 parts to the application: the online application, the monthly data report, and the budget. And we can take a quick look at each of those. So the application itself is online. Here's the link. And this is the bulk of the application. And you'll see that there's one, for organizations applying for multiple sites, you just need to fill out one online application. I'm gonna pull that up so you can see. And you can see you're able to select how many clinics you're applying for, and then the form will pre-populate with needed details about each health center that you're applying for. So there's a combination of narrative responses and fields for short answers in the application. And we haven't set a word count for the narrative responses, but I would encourage you to craft these thoughtfully. They don't have to be long. I'd say probably no more than 250 words or so, but they should make a compelling case for your health center, your organization. You also don't have to complete the online application in one sitting. You'll notice at the bottom, there's a button to submit or to save and return later. So you can save and return later. And if you prefer to draft your responses offline, there's also a preview document on the FPE CAP page that's available for that very purpose. All right, so let's talk about the monthly data report. At the bottom of that online application, you may have noticed there's a field for you to upload your 3-month data report. And you might be asking, what is this? And this is an Excel report from your EHR listing all services provided to clients in a given month. So the template that we've provided shows all the data reports that are required. Let's pull that up. Here they are. Including patient demographics, and you'll see here the diagnostic codes that we're looking to collect. And these are also listed on the monthly data report instructions sheet. And we've included on the website as well a sample report to show you the various ways that this might look. So there'll be 3 examples of different EHRs and how this data gets compiled into the report. And lastly, if you're listening to this and you know the person in charge of data at your site is going to want a little bit more guidance, then I encourage you to have them join Alex and Rebecca next week, next Tuesday at 11 a.m. for a webinar covering this process. And the link to register for that webinar is right on the FPE CAP application page. And the final piece is the budget. So here you'll spell out how you intend to use that cash grant of between $38,000 to $100,000 for the 2-year period. There are a few categories of expenses that we anticipate clinics will need in order to provide comprehensive services, and those are personnel, equipment, and supplies. And in the budget template, you'll see space for each of these. Let's pull that up. So what should not appear in your budget? We're trying not to be too prescriptive about what money is spent on, but costs associated with training or travel to training don't need to be included in your budget. We'll cover those. Marketing, since we're running that marketing campaign centrally, and especially cost for the methods themselves. So you don't need to budget for IUDs and implants here. We'll be stocking those directly. And I say that with one tiny caveat, which is that the time between submitting a claim to us and getting reimbursed is about $60. So if you're thinking that it's going to be cost prohibitive to get that initial stock of short-acting methods on hand, if that's going to impose a burden to your clinic, then you can budget some seed money to purchase those first couple months of short-acting methods. 2 more notes about the budget. If you're applying for multiple sites, you can submit one budget per clinic, or you can submit an integrated budget that shows clinic expenses, individual expenses for each clinic. And I empower you to pick whatever makes the most sense for your context. So for example, if you have personnel sort of centrally at the organizational level that you want to include, you could either add those, their level of effort to each clinic budget, or you could include one section of your budget for cross-cutting organizational personnel. And the last thing I want to note is that if you do choose to use this template, note that there are formulas in here. So you'll enter in information in the yellow fields. And the formulas will calculate when you select the table. So let's say, for example, we have nurse practitioner. Let's make up salary. We'll enter in percent full-time employment, let's say 10%. So what we want to do is select this table, press function F9, and you'll see that that calculates for you the totals, so you don't have to get out your little Texas Instruments calculator and do it yourself. And that's all for the budget. And then I want to open it up to questions. See if we have any in the chat box. Okay, well, there's one question about if we're selected for cohort 2, when could we expect to start being trained? And that's a really great question. We'll be able to have a better sense of planning that once we select the clinics and have a sense of the geographic spread and creating an itinerary. But I would say sites should anticipate an onboarding process beginning in late August or September in order to start October 1st, really hitting the ground running. So another question is, what if we're already doing a pretty stellar job and we're offering same-day IUD and implant services, and we really don't feel like we need that technical assistance? And the great thing is we have Jessica Lewis-Caporal on our team, our nurse practitioner, and what we'll be doing is having her come and do a visit and helping with those clinical pearls of wisdom, just to see where you are and offer any additional support. So we have a question: what if we're not currently billing Medicaid and we don't have ICD-10 codes in our EHR, but we're working on billing? So as I mentioned, being able to bill for Medicaid is a program requirement, and we can talk online, talk offline about specific cases, and but we'll take that offline. And again, that's another case in which deciding between applying for cohort 2 and cohort 3 might come in. If it's possible to demonstrate successful billing by January 2020, then that's certainly something that we can keep in mind with selection. All right. Well, I'm going to let you all go today, but not before I give you my contact information. So feel free to reach out if you have any questions that come up afterwards. You can also schedule a time to chat with me through the Calendly link here, which is available on our website. We are really looking forward to receiving your applications and supporting you in any way necessary in the next month or so. All right, thanks so much. Take care.